Now, I think it can seem like healthy eating and ultimately being adherent to a specific plan can seem a little difficult for some patients versus others. And I think there's a temptation to look at patients and be like, why do they seem to be non-compliant and why aren't they adhering to what we want them to do? But I think there's a number of challenges that sometimes unfortunately can go unnoticed that connects to why healthy eating and exercise and all these things can be difficult for some. And there's major problems that I would say extend to throughout the entire country when it comes to ultimately people being able to eat healthy and take care of their lifestyle. And the specific thing that I want to highlight in this episode is the issue of food insecurity. Something that I think can go unnoticed is the fact that your access to quality foods is very important when it comes to ultimately being able to take care of your health. Now, I want to highlight a couple things here. First of all, let's just start off with the term food insecurity. What exactly is that for those listening that might not have an idea of that? So, what I want to do is I want to take an official definition from the Office of Disease Prevention and Health Promotion. And I want to talk about what exactly this thing of food insecurity is. Now, according to them, food insecurity is defined as household level economic and social condition of limited or uncertain access to food, to adequate food. Now, this is something that, and it may come as a surprise to some people, but this is something that impacts a very, very large population of people across this country. As they even say, looking back at 2020, 13.8 million households were food insecure at some time during that year. So food insecurity is something that impacts millions of people. Access to healthy, quality foods can be limited depending on even just what neighborhood you're in. Your zip code can say a lot about how much access you have to quality foods. And as I'm going to get into this, ultimately your health outcomes. I want to point out another term. This is something that I've talked about in the past on the podcast, if you go back to even the first season of the podcast. But I think it's something I want to emphasize right now, and that's the concept of food deserts. So what exactly is a food desert? I'm going to spell that out for you guys. I'm taking this from medicalnewstoday.com because I think they do a great job of giving us an idea of what exactly a food desert is. But the concept of a food desert, and again, this is going to connect to food insecurity. Food deserts are areas where people have limited access to a variety of healthy foods. So that may be due to a number of things: a lack of nearby stores selling fresh produce, a lack of transportation, or poverty and high costs of these foods. So there are a lot of communities that ultimately don't really have great access to quality food. So we're expecting our patients, you can think about it as like we're expecting our patients to be able to eat healthy and take care of their bodies. But if it doesn't even seem like those people have access to quality foods at an affordable price, they're not going to be able to do that very well. And I can just imagine, again, from the perspective of the physician, it can be hard to expect somebody to eat a nice Mediterranean diet and take care of their lifestyle if they're over a mile away from the nearest supermarket and McDonald's is there nearby. It's going to be pretty difficult to have that person optimize their health and their lifestyle. Now, I want to go a little bit deeper into this, and I want to point our attention to an article titled Food Insecurity, Neighborhood Food Environment, and Health Disparities. And there's a point that they bring in here that I think is going to tie some of this stuff together. Now, what they found was that one recent longitudinal analysis found that higher diet quality was associated with proximity to and density of food stores, neighborhood socioeconomic status, and with perceptions of healthy food environments. So again, if we want to ultimately be able to eat healthy and to have a good diet, there needs to be some access to those things. But there's a lot of communities across the United States that don't have great access to quality food. Another point I want to illustrate here is the fact that, again, you can imagine if someone is living in a food desert, living in a community where there's not great access to quality foods at an affordable price, their health outcomes are going to suffer. And to point that out, I want to point our attention to one particular study, the Association of Food Insecurity and Risk of Mortality, a systematic review and meta-analysis of large-scale cohorts. So specifically what happens here in this study is they do a meta-analysis and take a look at what exactly is the association between food insecurity and mortality, death. And what they found was that after synthesizing 19 studies, 18 cohort studies, one cross-sectional study, a significant association between food insecurity and both all-cause mortality and cardiovascular-related mortality. So clearly there's a connection there between food insecurity, not having access to those quality foods, and ultimately not living as long. They found a significant relationship between the two, and another detail, there was a stronger relationship in Canada compared to the US, but again, I think this is something that applies very directly to the health of a lot of people in the United States. Now, to go a bit further, again, I'm going to really push this point forward. Looking at a study titled The Association Between Living in Food Deserts and Cardiovascular Risk, what they found was that compared to those that were not living in food deserts, subjects that were living in food deserts had a higher prevalence of hypertension and smoking, higher BMI, fasting glucose, and 10-year risk for cardiovascular disease. So obviously, again, food insecurity is something that impacts health outcomes, so it's something that we definitely have to keep in mind. Now, to go a bit further into this topic, I want to talk about another aspect of things that may be easy to overlook, but I think is important. There's a number of different factors when it comes to people's lives that really intersect with this problem of food deserts and food insecurity, and I think it's something that's worth paying some attention to. There's the fact that certain communities are going to deal with higher rates of food deserts compared to other communities, so there can be some discrepancy when it comes to these things. And factors like lower income can exist in a lot of the communities that have higher rates of food insecurity. But another point that I also want to talk about here is the fact that demographics can also connect to this particular issue. And I think one important factor that has to be kept in mind is that food insecurity correlates with race in a lot of these communities. And to highlight this, I want to point our attention to another study titled Food Insecurity and Poor Health, Understanding the Mechanisms and Informing Better Solutions. And what they emphasize here is the fact that a lot of communities that are predominantly non-Hispanic Black and Hispanic have higher rates of food insecurity. So they basically compared both food insecure households to food secure households, and they were able to find some different factors that intersect with that. Specifically, they note that many differences were identified among individuals living in food secure versus food insecure households. The latter, so food insecure households, pay attention to this, were more likely to be younger, identify as non-Hispanic Black or Hispanic, have lower education and outcome and income, be unemployed, lack regular healthcare access or private health insurance, not own a home, or be unmarried or living without a partner. So there's a number of factors here that also connect to this idea of food insecurity, that there are certain communities that have certain demographics, that have certain lifestyle factors, that have higher rates of food insecurity and are suffering from this problem disproportionately compared to others. And I think something that, again, has to be kept in mind, I think something that's worth noting is the fact that predominantly non-Hispanic Black and Hispanic communities have higher rates of food insecurity. So I think it just shows that food insecurity is a key part of the legacy of structural racism in the United States. And again, lower income is something that has to be thought about. There's a lot of these communities that are more food insecure tend to not have as high of income. Now, I want to, again, go a little bit further with this. Looking at another study that titled Examining the Impact of Structural Racism on Food Insecurity, Implications for Addressing Racial and Ethnic Disparities, they highlight that an analysis examining trends in food insecurity from 2001 to 2016 found that food insecurity rates for non-Hispanic Black and Hispanic households were at least twice that of non-Hispanic white households. So clearly there's some discrepancy here. Again, kind of getting back to that point of predominantly Black and brown communities tend to be dealing with food insecurity at higher rates compared to other communities. Now, I've talked a lot about the problem here. I think at this point you guys can kind of see that, where if you have communities that are food insecure, that are food deserts, that don't have access, where people can't just easily go to a supermarket and get quality food at a good price, their health is going to suffer. They're going to have higher rates of all-cause mortality and cardiovascular mortality and all of those things.